On to the last two presentations. I invite Dr. Soumya to present a problem resident.
Good afternoon, good evening everyone, and I thank Dr. Meenakshi ma'am for this opportunity. So I'll be presenting three aspects of a trainee's life. So where we can really know whether our trainee is on track or anything else to be needed. So those could be in the academics, in the clinical or surgical skills, and in the field of research. So I'm just presenting case scenarios, and probably I would be asking our esteemed panel that how, if really we could, or we could really solve these problems or make our trainees on track. Now, a final year resident doing a seminar on a topic which was given probably 6 weeks earlier. On the day, the seminar just comprised of very superficial information from not so authentic resources. Now, this has happened a couple of times, and the resident was strictly asked to correct it. So this has happened many times, and a topic which really requires a lot of reading. Probably, if we remember from our days when a seminar topic was given, probably 2 months before, we just used to refer to all the textbooks and make notes, including the applied aspects, the physiology, the basic sciences. But then probably we see our trainees, and not in the mind, actually criticizing them, but probably 15 or a week from now or a week before, they'll start preparing on the topic, they'll get the information and present it as a seminar. So really not so holistic approach about the subject. So probably how we could really make our trainee on track. So the one thing could be, we can just tell them that, now what were our efforts is, could be verified online resources. So we just provide them some online resources which are verified, like some known websites from which they could take the information, and also the authentic textbooks and monograms, which are excellent resources. That's very, I think in survey of ophthalmology, when it was really available, a lot of monographs, really review articles which could explain detailed about a particular subject, and also not only just looking at the topic, but including some applied aspects and basic physiology, pathology, pharmacology, as well as advances. So not only that clinically they are well equipped, but also to write an exam, to write a long question in their exams. So that also would help. And copy-paste attitude to be really stopped, because if they could read, if they could write on their own, that's definitely helpful for them even while writing their exams. And moderation from our side, pre-preparation of the seminar topic and showing it to a person who is the in-charge moderator could definitely help them probably correct their presentations and present it in a very good manner. I just expect any other inputs on this topic.
When Akshay was a resident a long time ago, they would, I'm sorry, it was maybe many 10 plus years ago, they would get extra idonation calls and have surgical privileges cut off. But I don't know anymore. How would you tackle something like this? Any thoughts?
I think, like you said, moderation from our side. So one of the things that one way that you'd get that time get it done was to assign a faculty member to essentially, to preview the presentation and approve of its contents a week beforehand. So that way it is done, and over if it's a well-oiled residency system, the moderators themselves, their reputation would precede themselves, and at least on this task, if they are particularly stern, word goes around quickly, and then they know that they have to show up and get the approved presentation a week or 5 days beforehand, and then it, that way, that is one way of streamlining it. The names I'm thinking of, so.
Probably making it a routine, a pattern kind of a thing, that you know that somebody is going to check your presentations. Yes, yeah.
Roster. Yes.
Yes, yes, yes. Correct.
And that's like a badge of shame. So,
Yeah.
that doesn't go down well with them.
Probably a senior or a peer, because I was thinking that for some residents, this can be a nuisance, and it can be expert surgeons and, wonderful clinicians, but they don't like so much the academia part of it. Can be not so much theoretical, and probably having the assistance, cooperation of their peers. Sometimes it for some, especially if they have peers that can be a little bit more, expedite in terms of setting this forward. But it can also be something that can even stimulate someone who is not so keen on the theoretical part of it, be a little bit more confident and more expert on that.
In fact, our roster used to be the resident will present the case, the fellow will do the discussion, and then there'll be a moderator who will do the comments.
I agree with Dr. Helena ma'am, and like suppose I get a topic to present, and but I'm stressed about presentation, like how to put the slides, like PowerPoint, making PowerPoint itself is a very new task that the person is learning, that the resident is doing for the first time probably in his life. And at this point of time, the peers or the seniors, when they go all sit in the library and read up the material, and okay, you put this, after this you do this. So that really helps, especially in the first few presentations, till the resident gets a hang of how to present a presentation. So,
Okay, thank you. Yes, ma'am. Another busy OT day. It's a camp OT where the final year resident student operated a mature cataract. It was now the turn of a second year resident. Next to him, a faculty was operating with a just microscope. The final year resident who operated first is busy outside the OR with mobile phones. He does not want to observe the consultant operating nor see his junior do the steps. He was told a couple of times previously too that he needs to observe cases repeatedly so that he can rectify his mistakes. So again, this is a common scenario where we also see this. So probably what what the best could be done is we can ask one of the seniors to finish this OT, and then operate or then monitor the junior resident who's junior second year who's operating. So probably can also say that at whatever particular difficulty he has, he needs to pitch in first, followed by the consultant who would do that. But then this has been going on. We have told these n number of times, but this also, it just crops up. So probably, I don't know, the repeatability and, okay, I know this, I know how to operate a cataract, so it's fine, I know I can operate everything, whatever I get on my platter. So that's also one thing. I mean, every time we say that each case is unique, each case is different, how you approach. That's also a very common, this one. So ma'am.
So again, the hook is going to be the key. Even for the previous case scenario, the hook is exams.
Yes.
So in my institute, my academic director is the internal examiner. So if you don't present that well, you know that you're in trouble. The same with this, if that final resident is not going to do that, no surgical cases.
So, yeah.
Cut the OT turn. That's going to be. It's going to be a harsh thing, but that's how.
But one more thing could be a kind of a portfolio where after you operate one case, if you could just write down what all mistakes you did in the previous case, and whether in this case what particular step which you had, something like an Oscar where we did a self-feedback. Similarly, if you could jot down what are all the problems we did in the cases. So probably in the next time, if you anticipate that the way you are doing, putting the incision or the way you are entering, every time repeatable steps, you're doing it bad. Probably do it a different way or approach a person who is doing it very nicely. So we could adapt at that particular step.
That's a good way. So reflective journaling is a very good tool. You can use Google Docs for the same. But it only works if you, as the mentor or teacher, has actually looked at the reflection. Otherwise, they never know whether they're on the right track or not. So it's a great tool, but only with supervision. But yeah, it works.
I was thinking about, the hook and the external hook and the internal hook. And I was struggling a little bit about that idea in terms of the motivations, our internal motivations and external motivations. And something that I think external motivations are very, very powerful. Examinations and assessment drives learning, right? But what I would like to find is some pathway that could, and I also pointed out in the presentation, a social cultural lens. But it doesn't mean that it's so much different in terms of geography, but to know what moves that trainee, what moves that fellow, what is to create that relationship so that we can bring up those internal motivations, because we always have external motivations, but if we do that as an internal, if we have an internal drive to keep our lifelong learning journey as professionals, as persons as well, but as professionals, I think that will be much easier and much enjoyable life in the future. And that will, I think that will, you know, shine around that way of being in life. So if we could make our mentees discovering that inner drives that make them learn, okay, with external motivation, but more important than that, they would face the external motivation more confidently and probably with higher marks. I don't know. But anyway, this is just an opinion. Thank you.
Thank you, ma'am. And moving to the research part, it was a busy OPD day at the hospital. A patient who was on topiramate had developed drug-induced glaucoma. So we had collected similar cases over a period of time, which would be published as an original article. The faculty offered to help in whatever way she could pull up to a publication out of this data. The faculty was on leave for a month, and she had asked the resident to mail her the manuscript. Even after the faculty came back, the trainee did not show any signs of having started to write the manuscript, in spite of telling that this is a mandatory requirement according to the NMC. So the responsibility is research. The questions would be, is research useful for my career? Research anxiety, difficult to do, fear of paper getting rejected, and I do not have any interest in research. Now, that's what. So this is the major concern, I guess. So even though NMC has mandated that it has to be accepted for publication or it has to be published. So that's one of the requirements now for postgraduates. Now in this again, we would have seen many interesting cases in our daily OPD. So alarming number of patients are more, so we would want to give them the treatment and go back. So in that particular thing, we had case series of such cases, and then definitely more than 5 or 6, which can be an original article by itself. Now that is again one area where we need to address.
Not just the trainees, I think this is each of these 5 applicable
I mean,
for the trainers.
probably is everyone on track, I guess. I don't know. That's it.
Problem trainer, problem trainee. So this is going to need any comments on this? Yeah. Yeah.
Yeah, that's what she was.
In terms of the type of the article, the type of thank you, the type of the journal that will be more, and also to help with the feeling that, as you said, this is the same, we are under the same sky, and it's difficult, it's hard, but when it happens, it's so exciting to see it published. So it is worthwhile to endure and to be resilient. I think these can be what the mentors can do in this type of cases. There are others who wouldn't like at all to do this, but I think that with peer support, it happens to be a little bit easier.
I guess the
Peer
positive,
support is very powerful, because this new generation are very gregarious and they are very helpful among each other, and so I think it's very useful on
I guess
that
the
side as
positive
well.
reinforcement that happens after a successful publication, I think says it all. Probably if they get into that groove, I guess.
Yeah. But be prepared for the, difficult, If you're rejected, it's no big deal. We are still alive. We are still here to fight.
Yes.
So, a couple of things. So at one of the places where I am an honorary, where we have residents, since 2019 now, it is 2017, it is now mandatory, at least in the MUHS, Maharashtra University, that every resident needs to present a paper or a poster at a state or a national conference and be Yeah, an NMC requirement. Yeah. No, but some of these are deemed universities, so they get to do their own things. But yeah, so having made it that way, a lot what the city has, the city Bombay Ophthalmic Association has done, taken up is organize a research seminar for all residents joining the ophthalmology course for all the medical schools in the city, and make it part of their annual conference on day 0 like this, a pre. So these things could help them in helping them. Also, there are a lot of wonderful online courses. You've got Sunny Sengupta running his research academy. So there are a lot of external sources that they can rely on, especially now that this is made a structured part of their residency, one of the prerequisites towards completion. We should also need to think out of the box and make it a prerequisite part of our planning for residents.
A lot of resources to help them out too. Thank you so much. Thank you, ma'am. Thank you.
Thank you, Dr. Soumya. For the last case, Dr. Akshay will be presenting. I want to again encourage all educators to please go to the Ophthalmology Foundation's website, which is OFECC, Ophthalmology Foundation Education Consortium campus, and look at the 21 teaching skills for ophthalmic educators. There are 21 modules, and you get a certificate for completing each module separately. And a lot of ground that we covered today can be found there, and they're very useful. Please pass this on to your colleagues as well, because a lot of work has gone into creating the modules, and a lot of speakers today here participated in the modules. And if you have any good ideas for modules for educators, please do write to us, and we can start working on them.